Hi friends, this is Ila. Welcome to Happy Nursing. Today we will discuss about the different levels of healthcare delivery system. Right now we are studying fundamentals of nursing. In my previous video I told you about Florence Nightingale and her contribution in the Crimean War. How she brought down the mortality rate of soldiers in the battlefield. The code of ethics for nurses and the roles of a nurse that a nurse can perform in the modern scenario. Today we will discuss about primary care, secondary care, tertiary care, restorative care, etc. Means the different levels of healthcare delivery system around us. Friends, if you like this video, then please like and share my video and subscribe my channel. And also don't forget to click the bell icon to get the notification of my next video. Let's get started. Healthcare delivery system is the process through which affordable health services are provided to a large number of individuals. Now it has different levels. Preventive and primary health care, secondary care, tertiary care, restorative care and continuing care. First of all, preventive and primary health care. Here the major goal is promotion of health. Besides that, it is very evident from the name that it deals with the prevention of diseases before their occurrence. As we all know, prevention is better than cure. So, preventive health care is related to the services which prevents the diseases from happening. Emphasis is given on a number of factors like personal hygiene, good nutrition, clean living environments, regular exercise, adequate rest, etc. Taking these measures reduces the chances of diseases. Even if the disease occurs, they help reduce complication and as a result, the healthcare cost also decreases. Primary healthcare is the essential healthcare which focuses on improving the health status of not only an individual but an entire population. Added to that, it also focuses on health education, proper nutrition, maternal or child health care, family planning, immunization, control of disease, etc. Different kinds of services under this category are school health services, occupational health services, services in physician's office or nursing centers or community centers, etc. Next is secondary care and tertiary care. Secondary care services are usually based in a hospital or clinic. It focuses on helping patients who are struggling with complex health conditions and require the support of a specialist. That means the disease has already occurred. Our previous level was dealing with when the disease has not yet occurred, and now we were trying to prevent it. Here the patient is actually suffering from a disease and needs specialized treatment. Tertiary care is also delivered in a hospital or specialized medical centers when the patient is referred from a primary or secondary care provider. That means here the damage is more extensive than the secondary level and cannot be managed through secondary care. Now some places where secondary and tertiary care is provided are hospitals, psychiatric facilities, etc. Hospital services include emergency and diagnostic services, general inpatient services, trauma care, surgery and intensive care if needed, and rehabilitation services. An intensive care unit is a hospital unit where critically ill patient is closely monitored using advanced technology such as cardiac monitors, mechanical ventilators and other multiple devices. Psychiatric facilities. These units are found in hospitals, clinics, private mental health hospitals, etc. Clients suffering from mental illness such as behavioral disorders, depression, mania or eating disorders are taken care of here. These facilities aim at stabilizing the clients through different activities, therapies and medicine, and ultimately discharging them with a plan for follow-up. Next is restorative care. Restore means to bring back something. Just like we say restoring the data, restoring the messages from our phone or computer. That means to bring back the data so that it does not lose. Similarly, our health is also very precious, which we need to restore after an illness. So, restorative care is the care which helps individuals to regain their health and functioning to the maximum level. It has several forms like home health care, rehabilitation, extended care facilities, etc. Home health care is individualized care by nurses to a client to help him adapt with the permanent or temporary physical limitation so that they can come back to the normal daily home routine. There are different kinds of services in home care. First one is wound care. If someone is having any surgical wound, nurse can change his sterile dressing, do procedures like surgical debridement, irrigation, etc. as well as teach them to the client and his family. Next is respiratory care. Oxygen therapy or nebulization can be given at home after discharge from the hospital, or if anyone is having tracheostomy, suctioning can also be done. Next is vital signs. Checking temperature, pulse, respiration and blood pressure using digital thermometer and BP machine in home is the most common care which a nurse and family both can provide. Next is elimination. Care related to elimination problems like home dialysis, colostomy and ileostomy care, urinary catheter care, etc. can also be done at home. Nutrition. Many a times patient get discharged with a feeding tube. It may be Ryle's tube, Frecka tube or any other kind of tube. In that case, care of that tube and administration of formula feeding are given by the nurse and the same is taught to the family. Medication and IV therapy. Sometimes patient has to be on long-term IV fluids or IV medication or subcutaneous medicines like low molecular weight heparin, insulin, etc. In that case, checking of blood glucose and providing these cares can be done at home by the nurse or the family after proper teaching, like how to handle the equipments, what to do in case of extravasation, etc. Next is rehabilitation. It is the process through which a patient with physical or mental illness is helped to come back to normal life and attain the fullest potential of functionality. For example, one who is suffering from acquired partial blindness must not be dependent on others. He or she should be able to do at least the household chores which he used to do before on his own. Other examples are ambulation training for a post-operative orthopedic patient, occupation therapy for a mentally ill patient, speech therapy for a patient with laryngectomy, etc. There are also drug rehabilitation centers which help the clients to become free from drug dependence. Next is extended care facilities. These are the facilities which provide intermediate medical and nursing care until discharge to home is safe. For example, one who has a brain injury resulting from a car accident may need rehabilitative and supportive care for a certain period of time from trained personnel before going back to community living. Next is continuing care. Continuing care is the services provided for a prolonged period to people who are suffering from a terminal illness or disabled persons who were never independent or those who have a permanent diagnosis. This kind of care is provided in nursing centers, assisted living facilities, respite care, adult daycare centers and hospices. A nursing center provides 24 hours care related to nursing, rehabilitation, dietary and recreational needs. Assisted living facilities. Here the clients reside who require minimal assistance in daily living activities but are otherwise independent. We have often seen around us or in our own family, if there is any disabled person, especially with physical or cognitive disabilities like one who cannot ambulate on his own, one who is suffering from persistent mental illness or brain injury or stroke, it's very difficult to take full-time care of him because the family member also has a full-time job or he or she has to take care of others also, manage the routine of home and outside, etc. So, in that case, respite care services is needed when trained volunteers provide care to an ill or disabled person at home while the family member is outside. Adult daycare centers also take care of disabled or dependent persons while their family members remain busy with their work. A hospice is a system where care is provided to a client suffering from terminal illness. Here the client and his family accept the fact that further treatment is only going to worsen his condition and measures will only be taken to reduce his pain and discomfort. Care in a hospice helps the client to have death with dignity. It can be applied to only those patients who have given their consent of not instituting measures of resuscitation in case of any emergency, also known as palliative care. So, that was all about the modern day healthcare delivery system. If you find my videos useful, then please like and share my videos and subscribe my channel. Thank you for watching.